Omri Amirav-Drory, who is general partner and head of NFX Bio. He leads pre-seed and seed stage investments in one of the legendary funds.
We manage 1.4 billion. Sweet spot is $2 to $5 million lead checks at seed. We invest in everything, but my focus is the intersection of biology and technology and longevity. Actually, my goal in life, my mission in life is to end involuntary death. Like, you won't live to 200 being sick most of the time. $38 trillion per year of additional healthy year of life. We're going to spend all this money to get to superhuman level AI that can cure all diseases. I think the best healthcare is to stay young and healthy. I'm excited about this future.
Do you think, Omri, there is a person born today who will live through 160? My name is Viktor Orlovsky, and we are here running a podcast, Ventures from the Valley. We have an exciting guest today, Omri Amirav-Drory, who is the general partner and head of NFX Bio. He leads pre-seed and seed stage investments in one of the legendary funds that pioneered consumer internet investments, and keep going in that direction, but also doing a lot of other stuff. So thanks, Omri, for joining.
Great to be here.
Maybe you can tell a little bit about yourself and your storyline.
Great. So my name is Omri. I'm one of the 5 general partners at NFX. We manage 1.4 billion. Sweet spot is $2 to $5 million lead checks at seed. We invest in everything, but my focus is the intersection of biology and technology and longevity. Actually, my goal in life, my mission in life is to end involuntary death and to have fun along the way. Otherwise, why bother? And my background is I started in academia, doing some hardcore biochemistry, a PhD back in Israel, then came to Stanford on a Fulbright fellowship, did my postdoc in the medical school. After 4 years, me and a couple of friends from Intel back in Israel started a company building software for bioengineers. We got seeds check also from NFX. That's how I met them initially. And then ran the company for 5.5 years. We got acquired by Twist Biosciences, a leading company making DNA or synthesizing DNA. I was head of corp dev there for 2.5 years until just before they IPO'd. And then, the IPO became a $10 billion company for a while. I left to start my own fund, a $10 million pre-seed fund called TechBio. And after 2 years, NFX had, as I said, invested in my company, but also helped me start the fund and invested in my fund, told me that it was a test and I passed it, so I should join them. So I joined them as a venture partner for Fund 2 and general partner for Fund 3 onward. We're currently on Fund 4.
And from the very start, you were doing biotech, right? So it was like you're the first one to basically build the biotech direction investment in NFX. Is that right?
Yeah. So,
or they were investing in biotech before, like real big?
So I introduced them to Mammoth Biosciences, which was a Fund 1 investment before I came, but I introduced them to the team and helped them kind of with the company, and I'm still involved with that company. And then they had some adjacent bio, but I joined to do the kind of hardcore, what I call tech bio. It's like biotech turning more into technology than biology. So technology first in biotech.
Okay. So maybe let's speak a little bit of NFX. And obviously, I read like every newsletter and watch every video for like probably last 7-8 years. And I'm inspired by everything you guys doing. Could you just give like a little bit of insight how like NFX is structured? So you said there are 5 partners, so you're one of 5 general partners. How big is the team? What is the responsibility split? How the decisions are being made? Maybe a little bit of like the unpacking of NFX for our listeners.
Yeah.
Well, mostly founders.
Sure. At NFX, we're around 50 people all in all. We have 5 general partners, 2 partners, and associate and principals. For sure, we have a small office in Israel led by my partner Gigi Levy-Weiss and my partner Sarai Bronfeld. They are kind of very much known in Israel, so they invest in, Gigi is kind of the king of Israel, I kind of jokingly said. So he invests in everything out of Israel. He's an expert in gaming and other things. And then And the rest of the team is in the Valley with the main office in San Francisco. It's a cool office. You could come visit. We even have like a small speakeasy bar and a dance floor, which we use sometimes.
I've been there. So yeah, it's a nice
and
place.
A small office.
I live in Menlo Park.
And I live in Menlo Park. So, in a small office in Palo Alto where I am right now. So 2 partners. I'm in Menlo Park. My partner James is a kind of network effect marketplace guru here in Palo Alto, and then my partner Morgan Baylor and Pete Flint in San Francisco. She came from Andreessen Horowitz and from Meta, where she was leading the crypto effort, and she's leading kind of crypto and space and deep tech investment. And Pete Flint started Trulia, that was sold to Zillow, another huge company. So he's a kind of prop tech, fintech, AI, everything guy. So I think it starts with the partners. Like it's an equal partnership. Like we like to respect each other and got each other back. We have one IC for everything, including bio. Usually in our investment committee, we start with bio, and we have Emily Laprus, the CEO of Twist, as a venture partner in our fund. So she's been a huge help for us.
How big is the investment committee?
Well, officially or unofficially? So unofficially,
unofficially,
we have a large investment committee where every Monday, the entire investment team plus our chief legal and our COO and our CFO and some other people join, so everybody knows what's going on and everybody kind of present their companies. Companies come to present to us as a partnership, etc. Voting members are the GPs, but again, I think to get the best companies, it can never be a consensus. I think the best, the only game in early stage VC is to find those unique companies, the power law companies, where it's like 100x returner, and those companies are unique and are always polarizing. What we are looking for is not the lack of weakness, but excellent. And, we are looking for somebody to really be excited and, kind of like, I want to do it no matter what. We listen to each other, obviously. Mainly, I see it where I don't want to bring companies that don't have conviction to the investment meeting. And then if I present a company and I lose conviction along the way, based on the feedback, etc., it's a big tell for me. And if I just, I heard you, I understand the downside and the upside, but I still totally want to do it. This is why. I don't remember we ever vetoed each other on a deal if we had like really, really strong conviction. But you listen to your partners. If they tell you, this founder looks good, but it's not compelling enough for fundraising. They know that they've seen so many founders, so I kind of listen to them and they listen to me.
You must have really a lot of inbound flow of startups, right? Probably hundreds, if not thousands a week, right? And you have to distinguish between those you will have a deep dive into or the one which you like pass up on. So how much for you does the warm referrals mean? And are you seriously looking into cold inbound activities? Do you have any process for that? Do you often invest into cold inbound? So somebody is knocking your door and you're excited to invest, or most of your deals are still warm connections? Somebody has to introduce.
Very good question. You're touching to the most important things in the VC, which is sourcing and selecting and winning deals, right? So for sourcing, you said you read everything we write, and thank you for that. We're trying not to just make AI slop. We are actually founders, and we write about things that we know and believe in and think about, and we not hesitate to put some spicy material. I wrote a whole essay about why investors become assholes that painted a big target on my back. But I wanted to be a reminder for me not to be negative, and to my founders. If I ever behave like that, please send me the presentation. Please send me the blog post and tell me where exactly so I can improve. You mentioned kind of deal flow and selection, right? So at NFX, we were trying to be like a startup. We have a software team internally, and we build tools to help us manage the deal flow. The one thing you don't want to be, again, it's all come back to the power law at early stage investing, where more startups will not return the money, and very few return everything. You don't want to create a machine that biases you towards the worst deals, right? So if you build something that makes it too slow and too cumbersome to kind of see the signal to noise, then you optimize for getting the worst deals. The best deals are hot, the best deals have the best referrals, the best deals, they won't wait for you, right? You need to be proactive. I also want to differentiate between playing on defense and playing on offense. Playing on defense is like, oh, I'm getting a bunch of deal flow. Being on offense is like thinking, writing, be genuinely, authentically into a space. Like I'm very genuinely into longevity. And then have a thesis around like, what are we looking for? Write about it, search it. For me, it's even like reading papers, scientific papers, and being on offense. Like, I want this. Then your mind is ready when the right startup arrive, or you start it yourself, right? So we prefer to be on offense more than defense, but we also build a bunch of tools internally to help us, take care of all the deal flow. We get a lot of deal flow, especially when we run our fast programs, which is very quick money in the bank kind of programs. We can get thousands of deals a week, and we need to go through them very quickly. So we build a tool like C3, where it's an AI tool that go through kind of all the information we have in our internal CRM of the company and give it a score. And we optimize this after many, many rounds. And things that are high score, we try to see as quickly as possible. And look,
is it an autopilot or a copilot? I mean, this C3, does it like do work for yourself, or it just helps you to like find out the signal in all this noise?
First of all,
coming?
it starts with the fact that my partners really like Star Wars. So everything internal has some Star Wars. So we have X-Wing, and we have the Force, and we have Jedi, and we have like a bunch of kind of internal code names and stuff. So we have this suite of software we build internally called the Force, and that's where we live. It's kind of CRM. We every Zoom call we do, we auto prescribe and put in the CRM, every document, every interaction, every email goes there. And then we have tools like Chat NFX, where you can ask like question based on all our internal software.
GPT, okay.
We have a lot of tools that help us automate the process and make us more efficient. But in the end, look, you talked about referral. Referral is an important signal to noise. This game is all about signal to noise. Right, and are you the kind of, if you look, the way I tell it to founders, it's kind of cascading. Like if one of my founders tell me, "Wow, this is the best technology I ever seen," like you have to see it. Like I'll definitely take the meeting as soon as possible. If another investor that invested in the same round tell me, "Wow, I think this is amazing. I'm putting my money here. Do you want to join me in this round? I think you are a good fit for that." I'll definitely take a look. We even take a look at cold emails, or you should get like the warmest introduction possible. Like it's a known signal to noise, social hacking kind of thing. So as a good founder, that should be part of your superpowers. The worst thing you can do, the worst, especially early stage, is to use somebody like a banker or somebody who take a fee for introduction to investors. They are the worst. Like it's such a negative signal. Like we will not invest in you if you do that. Like seriously, like good founders should be able to found investors.
Fortunately, founders, early stage founders don't have enough cash to support this sort of activities.
You'll be surprised. There are a lot of shysters out there that says, "Hey, I'll introduce you to a bunch of investors. I want 5% of the deal." And if you're a first-time entrepreneur and you have no money and you don't know anything better, you might take the deal. It's saying like, if he gets me money, great. If not, like, if he does, it's just 5%. If he doesn't, like, it's a new investor, but they don't know how negative signal it is, And like, look, we spent,
it ends up nowhere.
VCs spend a lot of efforts to market themselves, to write, to be out there. We are very, very reachable. Like if you cannot find somebody in our network that can introduce you to us, we actually build a tool for that. We build a tool called Signal that does exactly that. You can log with your email. It looks at the metadata of your email. It's a huge list of investors, and you can see who in your network is the best introduction to that investor. We build a tool for that. Use it.
By the way, do you like, if you have certain conviction for a startup, but if you still are passing on that, Do you help these founders to find a good fit? Because you have like a broad network of co-investors, right? I mean, is it like something what you do, like helping a good founder, even this is not the best fit for NFX, to find an investor, or it's not your kind of mode of
I
operandi?
don't know. It's very hard, right? I'm involved in so many companies, on the board of so many companies, especially in bio. The last 2 years have been difficult, and I spend most of my time doing follow-up investing. So my allegiance is for my companies first, and then finding the best companies possible. Like if we decide not to invest in somebody, it's also not a great signal for me to send to somebody else. Like if we liked it enough, we would invest. So I don't think the founder wants my intro to those people. I'm happy to share. This way we build Signal. I'm happy to share kind of the network of all investors. That's why we build Signal, which is an external tool everybody can use. We build it for founders to help found investors. Yeah, that's kind of the quick answer.
Okay, sounds good. So let's go on. How many companies do you have in your portfolio? And how many do you add like on annual basis?
As a fund itself, we have hundreds. Now, a fund our size would usually do A rounds or B rounds. So, the traditional VC funds will make anywhere between 15 to 20 deals. And usually each partner does one deal per year per fund or something like that. We are very different. Maybe we're crazy, but we like the early stage. All my partners have been entrepreneurs themselves, or people of like $10 billion companies, and know how to build company and love the early stage. So we love the seed stage. Our sweet spot is $2 to $5 million, and we leave a lot of the fund for follow-up checks. That means that we're in a lot of companies, and it's a lot of work because another thing we do is we lead, we don't follow. One of my pet peeves with investors is like you have one job to make your mind, to get conviction and invest. And even this one job, most investor will give to somebody else and just follow based on somebody else's conviction, which is a valid thing to do. Don't get me wrong, but I don't have a huge amount of respect for that. If you can lead, have conviction, like believe in something. Like you don't have to have somebody else tell you it's good. Because we do lead, we do start boards, we sit in boards. It means that we work a lot. So I'm on the board of 21 companies, and it's a lot of work. But
21 companies.
Yeah, but I love it.
And how many biotech companies are in the portfolio?
So I'm the only bio partner out of 5. So
you're only partner.
Yeah, so it's like 5.
So you sit in every company's board to invest in, basically, until certain point,
until certain
right?
point, and
probably like Series D, you just wiped out.
Yeah, it depends on if we're co-leads. Depends on the next round. Sometimes I become an observer. And some companies I start with not as a board member, but I become a board member. So it's different. We just like to, because we lead the investment and we write the biggest check on seed usually, then we also on the board. And I think it's important. Like too many seed and pre-seed fund doesn't start a board. They say it's just overhead. But I think like once every quarter to say like, okay, you said that you're going to do this and this is what you actually did. What went right, what went wrong, how the market is looking. Let's evaluate our runway, etc. It's very good for the companies, and you should start that as soon as possible. And, oversight is good, So yeah, so it's not work. So we involved, like I think fund 3 was 81 something co-investment, and it all goes back to the Parlo. Our pitch to our LPs, our investors, is very simple. We're a general seed fund, the best markets, Israel, the Bay Area mainly, but we can invest everywhere in the US, etc. Each of us, we're general, but each of us has their own uniqueness and the reason why the best entrepreneurs will come to us. And then, so with one check, you get exposure to the best market, to all seed, not just bio, not just tech, not just AI, not just everything. And we take, board seat, we lead, we have enough equity in each company that we only have one metric in our IC for investment, only one. Will this company return the entire fund? We have to believe that each company will make an investment, and fund 3 was 81 companies, core companies. Each of them, when we invested, we have to believe could, at the very least, return the fund. Because of the power law, most companies will not, a few will. And then we have enough money to follow up, invest, and keep our equity in the winners. And that's how it works. So, the job of each of the GPs is to find one company that returned the fund 5 GPs, 5x fund.
Absolutely.
That's, we did our job.
So how much of a dry powder do you leave usually for follow-on?
It depends between half the fund to third of the fund. It depends on the year, depending on the demand, depending a lot, right? You want to leave enough dry powder. It also depends on the market. That's where there's a big difference between, crypto, software, AI, and bio, for example. In some markets, you can get product market fit fairly easy. You can get revenue. You're allowed to sell what you're making. You have fast growing revenues, so the dilution is not as harsh at follow-up investment rounds. And in some markets, like deep biotech, if you develop a drug, you're not allowed to sell anything until you get FDA approval, and that can take a long time and cost a lot of money. So you are more dependent on partnership revenues or just technical milestones. And then until you get clinical data, the dilution can be harsher. So, the requirement for follow-up investment is different, etc. Yeah.
By the way, is like biotech as a separate vehicle, separate fund? So you raise for like biotech, or investors, your LPs get by like a diversified portfolio of little bit of biotech, little bit of consumer internet, B2B, or it's all divided into kind of separate
we
funds?
Have one
How
pool
is
of
it
capital.
structured?
So we have fund 1, 2, 3, 4, and an opportunity fund, but every fund.
And then you split within the fund.
Yeah, and again, it's a.
So you split your kind of.
And it's a totally equal partnership. So we get the same salary and the same carry. And that means that we're helping each other and not kind of like it's very hard to be a totally equal partnership, right? Not everybody is equal. And sometimes somebody can be more lucky than other. One market can be harder than other. And, but if you trust and believe in your partners, it's a long-term game. Every fund is at least 10 years and it's still almost your retirement job. Like it's your last job you'll ever do. So, and sometimes, biotech, you invest during a time like now that biotech is down, so you can get high equity in amazing companies. And those companies can be the best companies in the bunch in 7-8 years when it's all said and done. And one time, you invest in AI when it was down, or crypto when it was down, and then 7-8 years might be up. And, hopefully not the other way around, where you buy when it's very hot and hypey and you sell when it's very low. That would be very bad.
Yeah. Well, it's important. It's less important for you guys because you invest in seed. So for seed rounds, it's not that much important, like the macro, right? Because you never know where you will end up, like, because that's the 10 years journey, right? So in 10 years, you could not predict 10 years ahead, right?
Yeah.
You don't know where economy will be in 10 years, right? So for seed investors, you're not buying any market risk. So you're bypassing it because you could not really evaluate it in any meaningful way, right?
Bypass it. I think we just know that it's not under our control. We just accept it. So that's part of the risk of investing in seed. On the one hand, it's still less competitive than follow-up investing. You have less information, so it's harder to automate, right? I think AI will take everybody's job in the end, but right now it's still, you need to talk to humans and need to have a belief and conviction of a future that is uncertain. And you need to be okay understanding the power law. You need to be okay with half your company is going to zero. Like even the best investors, if it doesn't happen, it means that you're not ambitious enough. You won't get 100x if you don't get like the zeros. Like, the best companies are kind of moonshot that, but it's our job every time. Like if we see a company that has a 10% chance to be a multi-billion-dollar company, we should invest every time. And most people will not. We say, what? Like it's like 90% chance of failure. Like if you're the pessimistic guy in an early stage fund, the problem is that you will be right most of the time. But you will not make money.
If you're a pessimistic guy, you will never go. If you're a pessimistic guy, you will never go to do venture business.
That's also true. True.
You could not be pessimist because you're investing in future. Investing in future, you should believe that this future exists. If you do not believe the future exists, you're not going to do it.
Because the risk of early stage investment is not to invest in the wrong company. It's not invest in the right company. That's the biggest risk. Like if you didn't invest in Google, if you didn't invest in one of those big companies, then you're screwed. And one good investment can cover all the rest.
The fear of missing out is something what is driving the venture capital markets, right? to your point, we are all ready to lose, but we are not ready to lose the opportunity, right? Because if you bypass the opportunity, and then this is Google or Meta or anything, that's where you are critical to yourself, right? That's where you actually
It's not
missing
that
out, not where you investing and
Yeah,
not
it's not
making
that
it.
we like to lose our money with investment. Like it hurts a lot. And by the way, this is where
No,
I think the
nobody
biggest
likes.
struggle of being an investor over time is the struggle between what you understand mentally and what you feel emotionally. There are a lot of things we kind of know are true mentally, but very hard emotionally. It doesn't matter how we know coldly that it's right. It's still hard. It's like telling somebody who just broke up that there are many fish in the sea and you'll find somebody else. Yes, it's kind of right, most likely, but he doesn't want to hear it right now. He's going through a heartbreak, right? So for investors, like, during an upturn, during a bubble, like mentally, you should sell to a bubble. You shouldn't buy. Everything is hyped and over, it's too expensive. You shouldn't buy to a bubble. But mentally, like emotionally, everybody, like every company is getting a 10 term sheet. You want to win. Everybody's raising
Mhm.
follow-up investing. Everything looks amazing and big and whatever. So it's so hard to be part of the herd. And then during a downturn, we are doing a biotech downturn. Mentally, it's like the best time to invest. You can get the most equity in the best companies that you did deep diligence because you had time. But emotionally, it's horrible. It's very hard to follow up invest. Like your best companies are getting only one term sheet for not a great price. Like it's emotionally very, very hard. And the big companies are just closing left and right. The market is very depressed. But you have to see through it. And I think, again, investing is a long game of being optimistic, of investing through a long time, in good times and bad times, in companies that can be massive. And if you do that, you'll be successful.
Totally true. So we have time now. So I would suggest that this second half we are dedicating to biotech itself, because you are not only an investor, you are famously known for your research and your like projects you were involved in. So you are one of the like a true expert in longevity, and I wanted to dedicate a little bit of time to this topic. So you published the business case for longevity and argued that the potential there is like 38 trillion in value. So maybe you can just elaborate a little bit on that and give your perspectives on the longevity market itself. So how do you see it? Because longevity, nobody's like really taking care, at least on the like state level, for like longevity.
That's
So
not
what I've
right.
heard is
I
that
actually think.
like, is it okay? Just
Yeah.
please
First of all,
elaborate.
it's
Yeah,
$38 trillion per year of additional healthy year of life. So
per year. Okay.
it's a huge
Yeah.
market. So let's unpack it. First, let's start with the word. I think the word longevity is problematic. It's a big tent where a lot of people who do a lot of very different things say the same words, longevity. Some people that are biohackers call themselves longevity people. Some people who sell supplements. Some people who work on the elderly. There's a bunch of people that call themselves longevity. For me, longevity is more longevity biotech. That's what I'm interested in. Like I'm interested in like hardcore solution that can potentially increase lifespan for as long as we want. Again, my goal in life is to end in voluntary death, right? And 9 of the 10 things that kills us, the biggest risk factor is how old you are. So aging is the main thing that kills us. So right now we don't have a healthcare system. We have a sick care system where, they wait until the damage accumulate and then present itself as a disease and then try to address a disease, usually when it's too late. I think the best healthcare is to stay young and healthy. Like that's healthcare for me, right? So when I talk to people in government, they see a lot of the problems facing Western societies coming from longevity in their mind, because people get older, get more chronic diseases, and then the most expensive time is the last 20 years, and they used to die immediately after getting Social Security. Now they live 20 years more. So it's a problem of healthcare and pension.
I heard the statistics. I heard the statistics that half of this budget goes to like the last year, right? Is it true
Yeah.
that the last year is half of the expense of this entire pension funds and stuff.
It's more than that. It's the
because
last
of
usually a few weeks where the most expensive. But when I think about longevity, I don't think about being 90 for 50 more years. I think about being 22 as long as I want. And that's a very different vision of longevity. That solves all America problems. That solves Social Security, that solves Medicare, Medicaid, fertility, which is a big issue in most of Western societies. It solves GDP because you have more healthy people, productive, which is just, that's GDP for you. So it solves all the major problems. And I think that's our major fall. Like when you ask people, do you want to live to 150? Not a lot of people raise their hands, but if you ask them, do you want to cure cancer? They'll raise their hand. They ask them, do you want to cure you want to cure Alzheimer? They raise their hand. Do you want to cure heart disease? They raise their hand. Do you want to look good when you're old? They raise their hand. So if you do all of that, it just means that you're young, young and healthy, right? So when people talk about lifespan and health span as two different things, where lifespan is how many years you're alive, and health span is how many years you are healthy. Right now, there's a big discrepancy because people live to their 90s, maybe all the 80s, but they're only healthy for 50 years or something like that. But I think in the future, it's kind of stupid differentiation. I think in the end, it's all lifespan. Like you won't live to 200 being sick most of the time. You only live to 200 if you're healthy most of the time. Right? If we cure all disease, we just live longer. And I think it's a noble pursuit. I think longevity now, especially radical longevity, is getting a bad reputation as being like tech bros trying to live longer on the expense of everybody else. For me, it's just the end game of one of humanity's biggest challenges and falls, which is tackling diseases. If you tackle all diseases, you're young. Right now the FDA doesn't consider aging to be a disease. But it is. It's a process that accumulates damage that manifests as diseases. So what GLP-1 drug like Ozempic showed us, that if you attack the root cause of disease, in that case, the root cause is people eating too much. What is the GLP-1 drugs? They just make you less hungry. You're not as hungry anymore. That's it. But this one thing, this breaking of this one addiction, solve obesity, solve diabetes,
crucial changes,
solve sleep apnea, solve some fertility, solve, it reduces Alzheimer's problem, it solve a lot of heart problems. So one thing, if you attack the root cause of disease, first of all, it's the biggest drug category in the world, right? It makes Lilly and Novo mountains of money. And B, it helps people. It helps all of us. Like it changed my life, for example. And I believe in 10, 20 years, 90% of Americans will be on GLP-1s because it's such an important drug. But while some people have issues with food and some people are overweight, everybody is aging. Everybody is aging. And aging is a root cause for 9 of the 10 things that kills us.
In a different speed, right? Different speed, but everybody is aging.
So when I invest in longevity, and again, it's something that I just generally authentically care about, I try to invest. So I call it the plan A, B, C, D plan for aging. And I try to invest especially in plan A, sometimes plan B, and I'm happy to talk about it. But I wrote a blog post about the race to 160, where I outline what I like to invest in. And I call it the race to 160 because humanity has already doubled lifespan twice. A few thousand years ago, we used to live to our 20s. And then during the Industrial Revolution, we doubled it to 40s. And now in modernity,
but this is because of the mortality of the kids, child's mortality.
That's a lot of
right?
it, but not all of it. So let me finish. So and now in modernity, we doubled it again to around 80 years plus minus, right? As you said, most of it was people not dying at a young age, but not everything, right? Because and what I said in the race to 160 is like we only have one doubling to go. Why? Because we know that some people, even 100 or 200 or 300 years ago, lived to their hundreds, right? Our biology that our technology, which is our biology that we were born with, if everything is optimal and we are very lucky, can get us to live to 100, 120. We have examples. We have people not great, not enjoying their life maybe in the last 20 years, but we have examples of people that can live that long. But, we have no example of somebody living to 160 as far as we know. Right. So, and I don't think we just randomly get there. I think we can only get there if we solve all the issues. Otherwise, it's a game of whack-a-mole where you try to cure this kind of cancer to get that kind of cancer, or you cure this kind of Alzheimer's to get that kind of heart disease, right? Only if we really, only things that can move the needle will get us there, and that's the thing I want to focus on.
Do you think, Omri, there is a person born today who will live through 160?
I believe so. I think there is a chance for that, and I tell you why. Again, with my plan A, B, C, D for ending aging, we start with plan D, which is death, and we're all on plan D right now. The famous Brian Johnson is trying to optimize everything in his health. He's on plan D.
I know.
And Peter Attia, the famous doctor, is on plan D. We're all on plan D. Why? Because there is not amount of good, exercise, sleep, nutrition, and supplement that will get you to live to 160. Right? We all know that. That's plan D, and we're all on it, and it sucks. And a lot of longevity companies are still on plan D. They have something that might help you with 5%, which is great, but won't get you to 160. Plan C is cryonics, people trying to freeze themselves. It's not a solution, but it's a way to stop time. Maybe somebody in the future can solve the issue. I know a bunch of companies in that space. I personally don't invest, though. The only thing that is better than, plan D is plan C, right? But it's not great plan. I don't like it. And then plan B is bioengineering.
So you don't do plan D, plan C?
Yeah, I just don't. Personally, plan D doesn't move the needle. Plan C, I don't like because it gives agency for future generation, not our generation. Though some people that are very deep in longevity are actually on plan C because they believe they can solve it, especially for their parents during our lifetime. And the idea is like stopping time. If somebody had AIDS on the 80s and you froze them and somehow can store them today, you can cure them, right? And how many other diseases can we cure in the future? That's kind of the idea behind that. It's a insurance policy. And then plan B is bioengineering, and the root is that trying to really understand the root cause of disease, of different disease, and find a solution and cures. And we invest in a bunch of companies there. The problem is plan B is until you cure all diseases, you don't really move the needle because something will kill you. Because everything gets worse at the same time. That's aging. It's not just your heart and your heart and your brain and your immune system. They all get worse over time. So it's only a chance who will break first and manifest as a disease. But it's still worth doing. There's a business model for that. We invest in that. It matters. And plan A, at least for me, is alternative bodies or replacement. And the notion behind that is nature have solved aging. That's why the human species is 1 million years old, right? The way nature solved aging is through having a baby. If you're a man and you have a baby when you're 20, or if you have a baby when you're 80, the baby is still 0-year-old and has a full lifespan, right? Because nature know how to reset lifespan if you go through an embryo. And human, we solved aging for cars. Over the weekend, I went to Monterrey and there was a bunch of really old cars on the road that looks young and shiny. Why? Because maintenance, yes, but mainly they replace parts. So if you get young, genetically identical parts, and that's not a new idea. Science fiction is filled with the idea of getting parts from clones, etc. But there are companies working on this space. We created one of those companies, Renewal Bio, out of Israel. The technology was on the cover of Nature just 2 years ago, where the professor from the Weizmann Institute were able to get human embryos from stem cells. So they call it stemroid, or stem cell derived embryo models. We published when we were at day 14, now we're at day 23, 24, 25, beginning of gastrulation. It's a very exciting company which has ethical, scalable way of producing young, genetically identical starting with cells and tissues and organs, and maybe one day a whole body, right? And that could be a big cure for almost everything. That's a kind of moonshot thinking that we like. We also invest in 2 other longevity companies, a company out of the Bay Area, two of them out of the Bay Area, one called Permanence, who is trying to develop molecules to reduce mutations, both to prevent cancer, but also to prevent a lot of aging. A lot of aging is just mutation accumulating over time. And a company called Powerhouse Bio, which is working on the powerhouse of the cell, the mitochondria, producing precision therapies for mitochondria. So, we put our money where our mouth is.
Well, what about plan E, convergence with electronics, where we are becoming a kind of artificial, so our brain is kind of departed from our human bodies and bio, and where we have a full replica of ourselves.
Yeah.
with the consciousness. Is it something what you think will be kind of a future of mankind
It's a
in a
good
way?
question.
That there will be like a full convergence between like what we call now AI and machine to like human and back?
First of all, who knows, right? Second, I talked about Brian Johnson as part of Plan D, but I met Brian. He's a very smart, nice guy. And when you talk to him, he'll tell you to your face. I don't think he believes that his method will get you to live to 160 and beyond. I think what he believes that what he preaches, don't die. It's like stay alive for the next 20 years because AI is coming, and then
and your investments and your investments, by the way.
I still don't know between there and there. Hand wave, AI will save us. Now, AI might save us. You know, I don't know. Some people call it the singularity because you cannot predict after that point, and who knows, you know, but I like to invest in things that I see how we get there. I think I see how we get there with the replacement parts. Like I see that, like just waiting around till the AI is smart enough to get into our body and fix everything from the inside or to upload us to the cloud. Well, I get pitches like that every day. It's funny being here in the Bay Area. You get the best pitches in the world, but and you listen to them. Like you know, nobody will kick you out of a VC meeting for pitching uploads or stuff like that. So it's very cool. Even if your business model is
welcome to
even
the Bay
if your
Area.
business model is ads on your afterlife, or one of the features is being able to simulate MDMA live. That was part of the pitch. Imagine the feeling you have on MDMA if you press a button. I'm like, what are you talking about? Anyhow, yeah. So I like the biology part. Maybe I'm too attached to my kind of body and physicality. Again, I think can life work on other substrate, or can we just, instead of trying to fix the entire body, just work on the brain and then connect everything else to a machine? Maybe. I don't know if that's a future I'm excited about, but people are working on it. There's a company called Science here that Max Hodak
Are you investing in this?
Personally, no. But again, if I see the right pitch, the right company, I might. But I haven't yet. It's very hard. I think I like longevity a lot, but it's very hard to find scientifically valid things to do. And usually when there is something scientifically valid, there's a lot of money and energy behind it. And there's a lot of because people care about it so much, it's almost like a religion. Like the fear of death is something that drives other people to religion, for example. It's you have some people are kind of weird and some ideas are kind of improbable. So you have to know what to bet on, both people and technology.
Omri, when you speak of like 160, raised to 160, does that mean, is it a kind of a like barrier? So if we live to 160 with A/B plan, does it mean that we can extend it further to 200 and 250? I mean, it looks like if we start like with like proper A/B plan and we deliver, we will be able to like extend it further, right? There is no limit, basically. I mean, it could be like to raise 2000. So there is nothing to actually, no hurdle or no barrier further away, right? I mean, once you like replace and regenerate everything, probably you can just do it forever.
Oh yeah, right? Yeah. Again, don't catch me on the number 160. The idea was we only have one doubling to go. You know, more than anything else, right? You know, so it might be 140, it might be 180. Like, don't catch me with a specific number.
But this doubling will actually be kind of no end, right? So it will be like doubling, tripling, and quadrupling.
This is why I think it's so important. I think once we get there, it means that we have no upper limit. You know, it means that we solve all the issues because you just don't just get there. There might be a problem that crops up when you're 400, but I don't think so. I think if you are able to get to that age, it means that you have like complete regeneration and replacement, and like you can at the same amount live longer. Now, I'm not trying to eliminate death. I don't think that's possible. I'm trying to eliminate. Again, my goal in life is
diseases,
unwanted death. Like that's the thing I want. Like for most of us, as long as we are healthy, there's always more books to read and more parties to attend and more things to do, right? And then just age and disease just creep up on us too fast, and then we just lose the capability. And at some point, life is not worth living. But if you just stay young and healthy, most people, would like, and then if they don't like to, nobody stopped them to, from jumping from a building or something. I don't think we can cure that.
Absolutely. Absolutely. And all sort of actually disasters and
Oh yeah, you won't
whatever
stop
it
death.
is,
You
right?
just
I mean, still
involuntary
like
death.
that.
I think that's the
Yeah.
thing.
Yeah. Hmm. Absolutely. So let's speak a little bit about AI in biotech because it's like getting real big. I mean, we spoke about how you automate your work inside the NFX with AI, but I'm sure that all your, like, or most of your companies are utilizing AI for a bunch of things. So how do you think AI is changing biotech landscape overall? Is it like real big? Do you see like any further benefits with LLMs for what your portfolio companies
Yeah,
are
good
doing?
question. So I wrote two big blog posts about it. One, 2 years ago, actually, was the third wave of AI in bio, because all the AI hype, it wasn't the first wave. We had several waves of AI in bio. This is just the third, the way I count it. And the second, just recently, is that the AI utopia cannot exist without bio. So let me maybe take the both and just condense into one answer. When Dennis goes on stage, or when Sam Altman goes to stage, or when the CEO of NVIDIA goes to stage and talk about the billions and trillions they want to invest in AI, usually they don't say, oh, and we're going to spend all this money to make funny memes, right? Or we spend all this money to create a chatbot. No, they said, we're going to spend all this money to get to superhuman level AI that can cure all diseases, that can extend our lifespan, that can find new scientific discovery. That's what they're talking about. They're not talking about the next chatbot. And yet, a lot of the companies in bio now that are based on those AI technologies that are actually doing what those people are saying or claiming and raising hundreds of millions of billions of dollars to do, are actually doing, have a hard time to raise right now. And I was kind of annoyed about that. Seeing the next AI for whatever, that many of them are not very defensible, and the next version of the whatever LLM can destroy thousands companies, getting so many term sheets, such a high valuation, while bio companies actually using AI to do scientific breakthroughs that can really cure people, really struggling to fundraise. And they have defensibility, because in bio, no matter what, we have IP. It doesn't matter if there is a new version of the AI, you still own the IP around your molecule. And if you get approved, then you get a blockbuster drug. And the third wave of AI is the first wave of AI was just using computers to design small molecules to fit pockets, and the atom-wise, a bunch of companies like back in 2011, 12 started around that. The second wave of AI was when AI started understanding pictures. This is dog, this is mouse. So people start using it to put, this is cells with this disease, this is healthy cells, and then do a phenotypic drug discovery where you just throw a bunch of molecules on diseased cells at a high throughput rate, let the computer watch all the cells and see if some of them turn into a healthy phenotype as a way to develop drugs. That's the second wave, and a bunch of companies, Recursion, for example, start from that. And now we're at the third wave of AI in bio, where it's a combination of, when people talk about LLMs, they talk about, those software tools that, read the entire internet and then they predict the next word. There are LLMs for biology where instead of reading Wikipedia, they read, what evolution gave us, which is all the protein and DNA sequences that survived until today. So it was kind of pre-trained by evolution. And then you can use that to create LLMs that, instead of telling you what the next word should be, tell you what the next amino acid in the protein or the next DNA in a genome can be. And you can use it to do generative AI and to do de novo design of novel protein, novel genomes. And people are working on that at the cutting edge. And things like AlphaFold that can simulate protein folding, that also help AI. And then the third thing is AI is becoming really good at detecting signal to noise. And if you can close the loop on a specific problem, we have a company called Mana Bio who is using AI and automation to discover novel lipid nanoparticle to solve drug delivery, genetic drug delivery. So if you can close the loop where the AI reads a lot of data, suggests experiments, you use automation to do those experiments, test it on the real world, get the data back to AI, iterate, you can create models that can create novel drugs, novel delivery modalities, can simulate and kind of predict toxicity, etc. And that is really useful. But in the end, you get asset that you can develop as a drug or collaborate with other drug companies to produce a lot of different therapies to a lot of different indications.
Eventually, that's a very interesting thing. All humans are somewhat similar, right? I mean, we share common DNA, but we are so much different, right? And that's the reason why some drugs work and some don't, right? Some like stuff really helps and some actually damages, right? So do you think we are close to really like unlock it from like this language of nature we are coded in from A to Z, so that there will be like a digital twin of Victor or a digital twin of Omri, like 100% equal to what we are, so that you can simulate any kind of new molecular or new formula or whatever into like a specific like personality. So do you think it's gonna like happen in the next 5-10 years that it will be kind of like 100% simulated to like every bit of me or every bit of you?
Not in 5 to 10 years. What you're mentioning here is the really holy grail of the space, right? Because every other space, when you build a house, you don't need to build a billion houses and see which one stands. And when you build a car, you don't have to build a billion cars and see which one runs. You understand the physics behind that, and you have simulators where you simulate, and it usually works. That's why when rockets go now, all the way, to orbit, usually it works on the first try because you have good simulation tools. In bio, we don't have good simulation tools. People joke that we cured mouse from disease many times. This is because we tried drugs on mouse. In the past, people forget, but the first vaccine, etc., the researchers tried on themselves. And if you go all the way back to the past, our ancestors, when they went to the jungle and decided, should we eat that or not? One of them had to try, and one of them was like, this is good. And one of them died because he ate something toxic, right? So our ancestors were braver than us, I guess, or more desperate. We don't have good drugs on humans because we don't test on humans. We test on animals first and only then on humans. And there is a reason for that, which is we don't want to harm humans, and a lot of drugs are either A, toxic, or B, not effective enough. I think in small ways we'll get constant improvement. That's one thing AI is good at, is find biomarkers that are associated with a good outcome of disease. So there are a lot of companies that, usually when you have a drug and you look at the population, it helps a third, it doesn't do anything for a third, and it hurts a third. And now you can use a lot of data, like multi-omics data, RNA-seq data, a lot of data on the entire population, and try to find signal to noise, to find biomarkers that are associated with good outcomes. That's called, it started with oncology, and now you have precision oncology, where you only get a drug if you have the specific biomarkers. And then pharma likes it and hate it. They like it because it's easier to get approval because you're more effective, right? They don't like it because they prefer to sell the drug to everybody because it's a bigger market, right? But I think we're getting to the age of precision medicine in everything, where they based on the lot of data we can collect, and AI kind of trying to find signals out of the noise that humans cannot find, will get you a personalized therapy that is, your chance of working is higher and the chance for bad outcomes is lower, right? That will happen over time. 100% simulation, even if we have exponentially growing capabilities in computation, the problem also grows exponentially, right? We cannot even simulate one cell with the current technology for any length of time. We can only simulate very small protein for nanosecond or less, right? So, and then the more atoms you add to the simulation, and you need to simulate all the atoms interacting with all the atoms, it also grows exponentially. So even if we have exponentially growing computation, the problem is growing exponentially. So I think in small ways that are very important, we can get better over time, but 100% simulation, I don't see how we are doing it. Unless we are living in the simulation already, and they are doing it.
Yeah. So Yeah, so we will not see digital trials, which will come in place of human trials or animal trials anytime soon,
I
like
think we'll
in
see
full scope,
hybrid. I
right?
think we'll see with us already companies that
Mm-hmm.
are selling pharma companies with biomarkers and things
Mm-hmm.
that will help, like exclusion criteria for clinical trials, better recruitment for clinical trials, so you have better chances of success. Look, drugs are expensive not because pharma companies are greedy, is because they're stupid. Like if we were better at developing drugs, they shouldn't be that expensive. That's that expensive because for the one drug
Mm-hmm.
that works, we need to pay for the 90% of drugs that doesn't work that still costs us $1 billion to
Mm-hmm.
develop, right? Everybody wished we would be more effective, better, high yield at building drugs. By the way, I
Mm-hmm.
think as AI and automation will increase, I believe, in the next few years, it's
Mm-hmm.
such a strong deflationary force, right? Everything becomes cheaper. Like if you have a robot that can replace a coder, a $200,000 a year coder with $20,000, and then it's become $2,000, then become $20, right? You have a huge deflation in the economy. Everything become, which is for consumer great, everything become cheaper, but also the GDP is kind of shrinking, not exploding because everything is getting cheaper so fast,
Mm-hmm.
right? You need the market to explode in size to accumulate. I think healthcare will become going to become bigger part of the economy until we can really apply automation, AI, and technology in healthcare to reduce cost. Because right now, a lot of the new technology in healthcare actually increase costs. You create solution, but expensive solution.
Okay, so yeah, that's very much true. So, Omri, maybe last few questions on my side. I know that we are coming to the end of our podcast. What do you think of this DNA enhancements? Now, like my friend is working on solutions for horses, so you can order a horse with very specific skills, patterns, colors, even color of eyes, whatever you want, right? So you can just change the DNA and like make whatever horse you want for like consumer, for whatever client, right? So is it something what I mean? Obviously, you can do it with people at some point very efficiently, so you can actually produce like better people from the very beginning, right? I mean, not only solving the problem of aging, but also uh, having more like smarter people with better endurance, whatever you want, right? Better fit to current environment, pollution, whatever, right? So, do you think it will ever come true, or you think it will be like forbidden forever
Yeah,
to
so it's
experiment on
great question,
people?
and we only have 2 minutes, so I'll end with that. So first of all, it's already start to happen. There are companies in the Bay Area that if you do IVF, you can read the genetics of your embryos and put that genetic information into those companies like Orchid, and they'll give you kind of a dashboard of all your embryos based on their IQ and height and diseases and whatever, and you can choose your best embryo. I think the problem is we don't have enough embryo. Once we have eggs from stem cells, and you can create millions of embryos, then the vision of Gattaca, which is it's still you, just the best of you, and that just from selection that will exist. So in small ways, it already exists right now. In big ways, I talked to George Church from Harvard recently, and he persuaded me, if I talked about the plan ABCD plan for aging, that there is a plan A plus or S, so superior plan, and that's to replacement, and that's upgrades. So if you already replace, why just replace your lame body with your lame body, even if it's your young lame body? Why not improve it and make it stronger, more resistant to cancer, more resistant to disease, faster, smarter, everything else, right? And I definitely am for it. I think companies like Renewal offer us like an ethical, technical way of doing that. The problem is,
Are you investing in this sort of companies?
not yet, but again, I think it's almost inevitable because people care about their kids more than they care about anything, and if they can make them healthier by not getting disease, like elephant doesn't get cancer because they have a lot of like tumor suppressor gene. If you can do it with humans, it will be one of my theories is that in 50 years, having kids the old-fashioned way will be looked as cruelty because you didn't optimize your kids and improve it as much as possible to be resistant for disease, smarter, faster, better, anything in any way. So I see it happening. I think it's a good thing. I don't think everybody would look the same. People want different things. And then, I'm excited about this future. Hopefully it will arrive sooner than better.
and it's not going to create inequality, you think?
Yeah, well, I think you can.
Last question.
Usually the rich people get the technology first when it's expensive and bad. Think about this huge cell phone that rich people used to have, and now everybody has a better cell phone that is way cheaper. So, and remember, every generation you can just fix that inequality because the therapies will be cheaper and cheaper and better, and more people will have access to them. And in every generation, they can just improve their kids to be as good, if not better, than the last generation. So the rich people might get the crappy alpha version, and the poor people might get the great delta version. So,
thank you, Omri. Thank you very much, Omri, and I hope to see you in person when I'm back to the Valley, and will show up in NFX office in Menlo Park. Thank you. So that was Omri Amirav-Drory, general partner and head of NFX Bio, and Victor Arlovsky, Ventures from the Valley, a podcast which is brought to you by R136 Ventures. Stay with us, sign up, and hope to see you soon in our next series. Bye.